Confidentiality by Shayna Hales. Confidentiality. Confidentiality refers to the act of limiting disclosure of private matters. A provider has a responsibility to maintain the confidentiality of patient information and is not permitted to share information with others who do not have a legitimate need to know. Confidentiality and privacy. Breach of confidentiality of the patient's right to privacy has legal and ethical ramifications. Under no circumstance should patient information be shared for gossip or personal purposes. Conversation about a patient in the elevator, cafeteria, hallway, parking lot, or any public place is not permitted. Exchange of patient's information should only occur between people with the need and right to know and should always be discussed in private. Social media pros. Social media has many pros and cons, especially in the medical field. There are sites that connect healthcare professionals across the country and globally. There are healthcare-related sites, chat rooms, blogs, forums, and video sites that provide the opportunity for network, share, and problem-solving issues. Nurses can positively use electronic media to share workplace experiences, particularly those events that are challenging or emotionally charged. Social media cons. The inherent nature of social networking invites the sharing of personal information of work experiences that may reflect poorly on a nurse's professionalism. Nurses, like most of the society, are connected on social media and share their personal lives and experiences. However, sharing an experience about work or our patients requires more caution. Nurses have to be careful to not only not use the patient's name in a post, but also any other type of identifying information such as location, room number, or the patient's age. Confidentiality and privacy. As a profession, nursing is held to extremely high ethical standards to protect our patients' confidentiality. We have to be extra cautious of our actions and consider the possibilities of a breach in confidentiality. Always take extra precaution when posting on social media and use the opportunity wisely with consideration of the potential impact of your postings. BSN Essentials. Essential 4. Information Management of Application of Patient Care Technology. Knowledge and skills in information management and patient care technology are critical in the delivery of quality patient care. Uphold ethical standards related to data security, regulatory requirements, confidentiality, and the client's right to privacy. Cues and competencies. Informatics. Use information and technology to communicate, manage knowledge, mitigate error, and support decision making. One of the main focuses of informatics is to protect patient confidentiality while using electronic health records. Confidentiality in adolescents. Confidentiality is a major concern with adolescents and the care that they receive. Adolescents are more likely to seek care if they know their information is kept private and confidential. Although it is important to maintain confidentiality, it is encouraged by healthcare providers for the adolescent to talk to his or her parents about issues that affect health. Exceptions to confidentiality are child abuse, violent injuries, and sexually transmitted infections. Question. What is an example of an appropriate conversation/post about a patient's case that does not breach confidentiality? References.